Swayam Prabha. Digital India. Educated India.
All of you here, the experts, students, and my dear friends, thank you so much for giving me yet another opportunity to talk about the subject which is very, very close to my heart. So, as Professor just mentioned, Voxology is a highly misunderstood term. Not much about it has been discussed online or any site. Very little known and a lot of misunderstanding about Voxology, voice culture, voice training, vocology. So since the topic is an introduction to Voxology today, because Voxology in half an hour to 1 hour can only be an introduction, much lesser than that in fact. So the course that I have been blessed with, or I was blessed with, is a 5-year course, patented by Dr. Muhammad Yaqub, an Egyptian. He's no more. An interdisciplinary course between the Sultan Qaboos University, Oman, and the famous International ENT Hospital, Al Nada. So it is by itself an interdisciplinary work and course. And the moment we hear the word ology, I'm sure all of us know, it's only to do with therapy, like oncology, diabetology, ophthalmology, voxology. So vox, we all know, means voice in German. So ology is the science of voice which does not involve clinical intervention. So that itself tells us that it is not voice culture. The word culture itself means refining or developing, culturing, not culture, culturing, developing, improving. So that all of us are doing when we do a daily riyaz, whether it's for voice or for dance or whatever, our own arts or skills, we hone that by a daily practice with the aim to get refined or improve upon the existing raw material or the capacity. So that we are culturing, improving. But voxology is not that alone. Voice culturing or refining is only one small branch of voxology which comes at the end of the process. I'll try my best to share with you what I have understood about the science. So many decades of my interaction with the field and science, I'll just share with you the importance of a defined line of demarcation between culturing and science. The moment we say artistry of the voice, it talks about the facility of the voice, the facility of one particular voice for ornamentation, decoration demanded by the style. So every style of music has a significant, distinct method of ornamentation or decoration or beautifying. So that comes under artistry, science of artistry of that style. And the voice, which is being given the capacity to bring out that ornamentation, is called artistry of the voice. The science of application is artistry of the style, and the ability of the voice to apply that artistry is called the artistry of the voice. So, very briefly, we have touched upon those two terms of science and artistry of voice. But Voxology is such a huge, deep science, which is in simple terms the non-clinical therapy of the voice. It is a therapy which is going to take care of the shortfalls, any problems that the voice encounters, not a new voice as such. There are, of course, exercises and processes to improve a beginner's voice too. But Voxology is the method where a problem happens to a vocalist. It could be anything. It could be shrinking of the space, vocal space. It could be a wobbling voice. It could be a lack of breath control. It could be aberration, raspiness. It could be a non-cooperation of the voice, inconsistent voice, so many problems, both clinical and non-clinical. But the method of Voxology is non-clinical. So it's a much larger and deeper term to be understood. So the Voxologist is a licensed therapist who necessarily has to be a doctorate in vocal music, after which the course is done. So then what happens is, there are so many stages in the Voxology process that one has to understand. So it is not like a one pill end to a problem. So there is no medicine involved, unless otherwise there is some condition, clinical condition in the body which is impacting the vocal system. So since our topic is confined to introduction of Voxology, I am compelled, and it is more appropriate for me to explain to you the four necessary basic stages of Voxology. So Voxology starts with the assessment of the voice by the vocalist voxologist. That's how we call it. Because, see, we can give exercises orally, we can talk about an exercise, but the vocalist, voxologist, has to understand the difficulty what the singer patient is going through, for which the voxologist has to be a singer. I think we already discussed that. First stage is assessment of the voice, which is ideally personal. But now, people call upon the phone and say online assessment of the voice. The best assessment of the voice can happen only when the voxologist can see the vocalist, how the mouth is positioned, how the voice is produced, whether there is any straining, the nerves are seen, whether there is tension here. So many aspects have to be physically seen by the voxologist. I'm sorry, I keep drinking water, the significance of which I will discuss with you. Voxologist understands, number one, the strength of the voice, then the area of rectification. Why the strength? Because any change that has to happen for the better in the voice should happen without compromising an inherent strength, because we are going to handle the unseen part of the body. Isn't it? So it is simple terms, in simple terms, it is physiotherapy or yoga for the voice. So a lot of factors are taken into account, like the voice usage of the singer, how much of it is being used, is there a vocal abuse, dietary, what diet the person is following, any clinical condition of the body, which is very important for the voice. All this put together, a complete, in total, an assessment is done. After which, there is a process of rectification which has to be monitored over a period of time. Again, when we use the word rectification, it is going to be vocal exercises and one-to-one. There again we break the concept of a voice culture workshop where it is to a crowd. So there are very few stages at the elementary level where you can give a workshop, a voice exercise workshop in Voxology. After that it is all one-to-one, it is prescriptive therapy. So then the process of therapy goes, then we move to the third stage, which is called, can anybody guess other than Swaroop? Because he has already attended. So we have assessed the voice, we have rectified the voice. Do you think that is enough? Enhancement comes at the end. May I know who said that? I think you have attended me. You sang very well, both of you. Rehabilitation. Yeah. Because we don't want the problem to come again, right? Something went wrong somewhere. That is why the problem happened. It could be the style of singing, or you some kind of non-cooperation of the voice where you start manipulating. Then the problem occurs. So we have to first assess, rectify, rehabilitate, and then enhance. So we first assess, then we make sure that the problem is taken care of, then we do a rehabilitation to correct the method, and then enhance. So these 4 stages, if done, then that process is called Voxology. So when we use the word Voxology, we have to understand it is a clinical term with a non-clinical approach. And a voxologist compulsorily has to work with a clinical doctor. It is like that. So, for instance, because I'll have to draw examples from my own experience, so give me the permission. I work for Apollo Hospital in Chennai, Sundaram Medical Foundation, and Jerry Care. So these are the 3 hospitals I am tied up with. Because we are trained to diagnose by the ear. All the major disorders like nodules, phonatory gap is the least of the problems. Phonatory gap, nodules, polyps, paralysis of one or bilateral. So we diagnose by the ear. But we need a picture of the vocal cords to understand whether there are 2 nodules, a single nodule, where the nodules are. So then we get the help of the ENT specialist to do a video laryngoscopy. It's also Voxology. Here I'll just digress a little to talk about vocology. Vocology is a clinical treatment inside an ENT department. But Voxology is a non-clinical approach by a therapist. So that is pure science and clinical. Now, I will request one of you to tell me what is the most important part of the human body which supports voice production. How does it happen? Or let me put it this way. How is the voice produced?
Vocal cords and air.
Yeah, yes, sir. Sir, you are such a big stalwart, sir. Let the students.
Okay.
Controlled passage of air through the voice.
Yeah, so is it during inhalation or exhalation?
Exhalation.
Fantastic. What else? What else do you know about voice production? Please share with us.
Articulatory organs.
So that is for articulation.
The core.
problem. See, we all have to think together. Nothing is wrong here. Please.
Yeah.
You mean the stomach?
Yeah. How I can just explain how I perceive it. So,
Yeah.
suppose I have to sing a note. I fill my lungs up, and my diaphragm is also filled. And when the air from the lungs gets depleted, the diaphragm pulls in, and then that air pushes here, and then that voice is used.
Excellent. I think she'll get the prize, proficiency prize now. May I know your name, please?
My name is Tara Kanan.
Tara. So, voice production technique is something which we should know. We all know actually, but we don't organize these thoughts in our mind. We take the voice as granted as possible. Right? So, let's first start thinking together. Something we all know, but let's think together now. Will you agree with me if we say voice is the most important medium of expression? Because language. Emotions? Yeah. A newly born child. How does it express grief or happiness or no gestures, right? It is the voice. So voice is the greatest medium of expression. Then of course we become adults and sometimes we sound very sweet, but there are other emotions inside. That's different, that's totally different. So voice production again, like Voxology, has 4 stages. It's always better that we know this. As I said, we all know this, but we'll just quickly breeze through them. Then you will understand why there is a clinical, non-clinical approach to voice. So, we all know when we exhale, the vocal cords move, phonation happen, then this movement is called resonation, moving up, and inside the mouth, the sound produced is converted into meaningful sounds, which is called articulation. So articulation is different. Articulate very gently, articulate rudely, that is different. The process of pronunciation, that is articulation, which is more related to the lyrical importance. But one thing we all forget is air is coming out of the lungs. If air has to come out of the lungs, air has to go in. Inhale and exhale. There is another part of the body which is allowing all this to happen. A larynx, that is a vocal box, voice box. Nose is very important, I'm coming to that. See, this mechanism, which is not happening one after the other, okay, it's all happening at the same time. Respiration, phonation, resonation, articulation. There is another huge factor which allows this. My brain. Who is that brainy person? Okay, so now, have you come across coma patients? They are alive. All the functions of the body is going on. They can't talk. The brain is not active. So only if the brain instructs the vocal system to get into action, there is no phonation, whether to sing or talk. So that means, now I'm coming to the point. That means talking or singing is a voluntary action of the body. Am I right? Which means we can control our talking and singing. Whereas respiration is involuntary. From the time we come in and till the time we exit, we are, thank God. And thank God that A sound from vocal cords happen only when the brain decides. Otherwise, it will be a very noisy place, right? Because from the time we are born, please understand this, till the time we go, vocal cords are moving to allow the air to come out. Because it is at the end of the trachea. That is why I wanted to sit like this to show you. I'm sure you all know that, but I cannot introduce Voxology to you without explaining the science of voice production. So, windpipe is like this. No, foot pipe is like this. Both of them have the same opening here, right? And thank God there is a automatic door there. So when you breathe in and breathe out, the vocal cords which are at the end of the trachea is moving. So already it is just like the heart, it is always moving. But when you talk, what happens? This movement becomes okay. So much work, and God is so kind that He has given long hours of elasticity for the vocal cords, saying you talk all your life. But some of us are talking and talking and talking and taking the vocal cords for granted, causing vocal abuse. So talking itself is a huge miracle. So many things involved, from the brain, the ear, because unless we hear, we can't talk or sing, right? This is the way we learn a language. This is the way we hear a shruti. So the brain, the ears, the respiration, the vocal system, the vocal cords, the passage, pharynx, tonsil, all are important in resonation. So when you do anything on Voxology, you need to know this anatomical background and the various parts of the body involved, if we are going to call that process Voxology. It is science. And I personally feel every singer should know this, because what happens is, so we keep getting students, my throat is gone, something is wrong with my vocal cords. Immediately it is vocal cords. You know, in all probability, your vocal cords could be your last concern. It could be acidity, because please remember, children, my students, your stomach is the heart of your voice. Please remember, your stomach is the heart of your voice. So, this vocal system, which already we have explained, and there is a hollow space there because of the, the glands called larynx, and then you have thyroid glands there, a killer glands, which can directly and indirectly impact the voice. So altogether there is a hollow space there, so we call it voice box. Okay. Then we have all this lungs here, the sinuses, very important. Yeah, and okay, let me now digress a bit. So there is this common question saying, what determines the kind of voice that I have? The timbre. One, it is genetical. Two, the length and breadth of your vocal cords, the thickness of your vocal cords, the length of your neck. Can you believe this? The length of your nasal passage, the hollowness in your sinuses, the forehead, the shape of your head, the hollowness inside your mouth, which is called the vestibule, the length of your tongue. All these determine your voice anatomically, and then comes the language you speak. Have you thought about this before? Yes. So that's why they say, it is research, not speculation. Bengalis, Marathis, Keralites, Telugu people, Italians, opera singers, they have a voice which traverses the region easily, because the language has a lot of phonetical application more than other languages, and they use the area which we call There's something that we call, no? Head voice, very good. Because that's how we should address this region, not false voice. Unfortunately, in the south especially, some North Indian patients also say, I use my false voice. No. There is something called a falsetto, which is different. Indian music, all systems of music in the world, whether you like it or not, by default, it is an anatomical default that the voice traverses head to chest to head to chest. You have no control over it. When you try to control, you get voice problem, especially in the south. They say sing from your core. You can sing only from here. The vocal cords are here. The primary resonating area is this and the mouth, like the sound box of a tampura, a kudam. That's why they say open your mouth and sing. Secondary support system is your stomach, singing from the core. You can't physically say, now voice, go to the stomach. Now voice, go to the head. No. The body knows as long as you don't curtail the movement. So then there is so much to it. So singing from the core is to improve your abdominal breathing. I'm sure all of us know that the yogic breathing method, the ideal way is to involve your abdominal muscle and not your shoulders. So this is called clavicular breathing, shallow breathing. No. Your thoracic region should be very, very relaxed and the stomach should be involved. So when you sing, when you inhale, the balloon inflates. You push it out and you start exhaling, you deflate the balloon, you contract. We all know this. But how many of us apply that in singing? Okay. So here and there I am touching the important parts of the body which is controlling the vocal system. Stomach, I said. Now if I go into only stomach, then digestion, what are the do's and don'ts, drink a lot of water, all that I have to go. Water is very much necessary for digestion, we all know that. So, what suits your stomach? And why are we talking about stomach? Because stomach is the heart of the voice. Please remember this, okay? Every morning, please say that yourself twice. All singers, I'm telling you. So, what happens is what you eat shows what it is on your voice the next day. Because I'm sure there is a growing awareness of acid reflux and vocal cords damage. 15-year-olds and 80-year-olds are suffering. Top ranking musicians I'm talking about. Acid reflux can be caused by improper digestion, spicy food, untimely food, and some now of late, we see this keto, some please, lot of singers are suffering. I can mention one or two names because I have their permission. Dr. Ramakrishna Murthy, playback singer Sujata Mohan, all of them tried and see, genetic diet, please depend on that. So since I'm talking from the point of view of therapy, okay, so I will have to touch upon these points. When you change your diet, first observe your voice, whether it is suiting you. In some cases, there is an evident change in the voice then and there. In some cases, it is gradual, it is very stealthy. You also lose your stamina to sing because ours is a genetically carbohydrate based. So, of course, ours is a sedentary life too now. You have to balance that and not change your diet. Right? So, stomach, when you talk about stomach, the diet, we have to take care of. Water we have already spoken, and avoid fine flour, maida, pizza, all of them, because they take a longer time, like non-vegetarian, to digest. So when there is more time spent on digestion, there is some kind of an unwanted acid precipitating in your stomach, which climbs up the esophagus, ends up here. Initially, it is just one or two in a week. Later, it becomes a habit for this to move up. It eats up the very, very minute sensitive tissue around, and the movement of the vocal cords is curtailed, and then your higher and lower pitch, they shrink like this. With that you sing and sing, the elasticity is lost and they don't come together. Phonatory gap, it's called a waste stage. The third stage is you find small boils called nodules. There was a time when it was surgically removed, only surgically removed. Now we don't need surgery, with exercises we can. Voxology has a therapy for that. But why do you push our voice to that? So the moment why I'm coming back to that point. So the moment you have a voice issue, don't think there is something on your vocal cords. First sit quietly and think, did I drink enough water? Did I sleep well the previous day? Sleep. Not during the day. What have I eaten? What was my last meal? What was the previous meal? Sometimes after 24 hours, there is an alarm in the body. So think of the stomach first, then think whether you have been stressed. Stress can also cause acidity and stiffness. Because an ENT is going to tell you that there is a dysphonia. That's a very frightening word. Dysphonia is nothing but a change of voice. Now what causes a dysphonia could be anything. The same way, when you have some kind of a dysphonia feeling, don't think it is vocal cords. Think of all the other things, whether you have any breathlessness. It may not be wheezing or asthma. Sometimes you have an allergic condition, you feel a little breathless. That can affect your voice. A change of weather can affect your voice. Then immediately what we think, no, till yesterday I had no problem. I have been the same in Kashmir and in Chennai, very hot. So nothing happened to my voice. It can't be the same. Maybe it is same for over a few years. It keeps changing. Why does it change? Because you are aging. Our body is not a default set computer. Everything has an impact, from the food we eat, from the quantity of water we drink, from the sleep we have, and the duration of talking we do. So we already saw the beginning of the discussion that talking is a voluntary function. So it is within our limits, control, whether you want to talk for 1 hour or whether you want to follow the 4 don'ts. Don't talk loudly, don't talk too much, don't talk too long, don't talk too often. I think the youngsters are not happy with me. There's no smile at all. So when we are very careful with how much we talk and what we talk also, the more gentle we are, the sweeter the voices, the younger the voices. Because we already saw that voice is the expression of the human mind. So be gentle, voice is gentle. And when we talk less, not only is the voice saved, a lot of relationships are also saved. I'm sure you agree with me. So voice is so important, involving all the other functions of the body, and the most underrated, disregarded blessing of the Lord. Am I right? You all agree with me? I think this is the least we can cover now, the given time. Yes, please.
Actually, students are classical performers. Hours together they have to practice. Then how to...
Yes, that is a beautiful question, Doctor. So practice. So let's say there is a singer called A who practices for 4 hours a day. Then there is equally talented, skilled singer B who practices only 1 hour. So each vocal system is unique, much more unique than the blood group. You can match blood groups. No replacement for vocal system has happened till date. It's not available. It is much more unique. There are no identical vocal systems in the world. So, a singer has to first understand the most comfortable pitch, we say, vocal space. In Voxology, therapeutically it is called vocal space. In the normal, terminology, we say Shruti. That's better, others people will not understand. So let's say my Shruti is A. How much I can practice in A is something which I can understand over a period of time. So number one, so tomorrow I have a concert, today I should not practice for 5 hours. Today I should do voice rest. But I should have been practicing 2 hours every day throughout. So one is that. Two, how do we, most commonly asked question, how do we decide upon the right vocal space? So most commonly we say, I'm able to 2 octaves. I talk in terms of our Indian singing. The Tara Pancham and the lower Pancham I can reach easily and I'm moving easily, so I'm going to sing in that space. But let me tell you, that itself is not enough. I'm sure focused musicians, vocalists who practice would have by now understood that it's not enough if I reach. I should be able to negotiate the ornamentation expected. I should be able to negotiate the required breath support. Again, we are coming to the lungs, the most important thing, the breath support. Breath support while you talk is different from the breath support when you sing, support for the voice. Much more complex and demanding. The brain is controlling the pressure to go to the lower pitch and to the higher pitch. So, do I have that facility in that particular vocal space where my breath support is complete, I don't feel out of breath up there and down there? In both the places you need additional breath support compared to the Madhya Saptam. Is it there? Am I able to do the ornamentation easily? Is the voice listening to my... Because the brain says do all these ornamentation. But is the voice able to reproduce that? Am I able to sing, let's say I have to sing for 2 hours, is my voice getting tired? If all these factors are positive, then you are in the right space. Please do not keep changing your space. So there are some wrong understandings. So as I told you, A is practicing for 3 hours, so B feels I should also practice for 3 hours to lose the voice. So we cannot copy somebody's application, even style of singing, very important. So I can mention certain names so that it is more convincing. So I have this top ranking musician who's coming to us and saying, please give me exercises so that I can sing like Sri Abhishek Raghuraman. I said, for that please get his vocal cords. So, Voxology does not ensure the total change of the voice or the voice facility or efficiency. No. It is like any other therapy, treatment. It can help you handle a clinical condition, come out of it and maintain. It can improve a little from what is existing. It cannot replace. That itself means it is not voice culturing, right? It is therapy. Please underline. I would like to make you understand that. Voxology is a clinical thing where the person who's doing the course is a qualified therapist. We can't do that, right, unless we go through a medical school. Yeah. Then I will try to talk upon a few misunderstandings, okay? Deliberately I'm using the word misunderstanding. Singing in high pitch is very superior and singing in low pitch is inferior. Please, not at all. Again, like the practice session, people feel, I have to practice and sing in high. Don't do that, please. The space is very, very unique to the body and it is determined by the length, the breadth, the thickness of the vocal cords. The space. The timbre or the sound, so many other factors as we already saw, the language and other things. So please limit to your voice. Let's say you can reach pa, as I told you in A. Try to be steady there and improve there. Not try to go to C and go to pa. No. If you feel your voice has shrunk over a period of time, but you did have a more expansive space, get the help of a therapist. But don't on your own embark on a journey looking up there or looking down there. You will devastate your voice because it is the most fragile part of the body. As I told you, there is no replacement. So thank you for that question. A practice schedule is something which has to be arrived at over a long period of time. You have to know, today 2 hours, okay, tomorrow 2 hours and 15 minutes. Slowly, but it has to be arrived at. You can't practice for the whole day, the day previous to the concert. No.
That's what I
Yeah. No, many are doing that. Yeah. Then they take 1 month voice rest. Oh. Questions?
Ma'am, my question is that how voice affects by the stress, anxiety and other functions of brain.
So, functions of the brain, I am not competent to talk about that, but indirect impact of stress on the brain which affects the voice I can talk about. Before that, how it affects the voice, that was the first part of your question. I'll take that. Stress causes acidity, that is anatomical inward. Other than that, have you noticed when you hear something which is disturbing, you do that. There is a sudden inward inhalation which actually freezes there. After that, there is a shallow breathing which is called clavicular breathing, shallow. This affects the stamina, the strength and movement of the voice. Need not be only for singers. You just try running. Heartbeat increases. Then can you talk easily? There is not comfortable, right? The same thing while singing. So it is more evident while singing because there is control of the movement of the voice. While singing, it is not erratic. So it is even more complex. So that is a direct, on-the-spot impact of stress on the voice. Stress over a period of time affects the blood circulation, which clinically we say we end up having hypertension. So the movement of the blood circulation is accented, is increased. It affects your breathing. The moment it affects your breathing, or rather does not allow deep inhalation, there is not enough breath support for the voice as demanded by the brain. Okay. 3. It stiffens the entire, please pay a lot of attention to this. A lot of people stress here. Have you noticed? So when this part becomes rigid, voice production is affected. This is like the supporting body around a rocket which is going to take off. That's why we shout from the rooftop to the youngsters, don't go to the gym and lift heavy weights and make this part very well built. It will affect your voice over a period of time. So we have to decide whether we want to become bodybuilders or singers. You need to have a healthy body, yoga. You can do something in gym which is not harmful. This is not my opinion. This is research. So I thought 1 or 2 names were mentioned, film actresses who come, who also sing. There are so many others. Even those who simply act for voice modulation, when they come, we have to tell them that, see, this is for acting you need your physique, but you can't have both. So when this becomes stiff, the area around the vocal region, how many of you know that there are another set of duplicate vocal cords? Okay. So when you look down, so now I am the camera, okay? I am looking down at the The camera is a very small pin which you put, okay? It's not a big face like this, but just look into the vocal cords. What you first see is two tiny muscles. Underneath that we have the cords. So the moment you take weight from down, so we say, we do that, right? So they come forward. That is body's mechanism to strengthen here. But you go on doing it, that will start working and not the vocal cords. And you will eventually lose the voice. That is why they are called duplicate vocal folds. So these singers, so many playback singers when they come, even from Telugu industry, what happens is over a period of time, the music directors make them sing a particular genre, a particular kind of singing, husky. They are using their duplicate vocal cords more than the normal, original vocal cords. So for that to be that and not the vocal cords, you should see that this entire area is supple. Then only it supports the vocal area. If that is not done, either by physical exercise or by stress tightens you here. So you feel like doing this also sometimes, the neck, right? You may get arytenoids overriding, it's called. So these are all technical terms, so we need to know the anatomy of that, but never mind, vocal cords. So when the arytenoids, they override, so after the movement, they come like this. This is very bad. This rectification, because we can't physically change it, right? So, very difficult. There are so many singers who are going through this because of stress. Another grave problem is paralysis of one of the vocal cords, stress. So we feel stress does not affect only stress when we get heart attack or we get BP. No, stress can cause anything, indigestion, and this is happening. Why is it that when we go on the stage, suddenly children come and say, on the stage my voice never cooperates? It is stress. It controls the brain indirectly. So that's about it. So, have I answered? Yeah.
No. And without memorizing the Sahitya, they will see the book. So, posture is very important for singing practice. And also, one more question. Mainly in Carnatic music, ragas like Riti Gaula, Ananda Bhairavi, bass Natakaranji. So, definitely you have to develop bass sangatis. So, can you please suggest some exercise for...
Okay.
Yeah, that is
so the question is, how do you improve your range?
Range, particularly the lower.
Yeah.
Because our in Carnatic, you may know, Carnatic music, most ragas are in bass sangatis most will be there. Yeah, Tarasthai Panchama very rare in composition also.
Okay.
In raga and swarakalpana we may reach, but in composition like Paripala Imam, Riti Gaula, so bass voice will be there. How to concentrate on that? Okay. And also sitting position also.
Yeah. The first part of that, yeah. So we all know that posture, when the moment we talk about sitting posture, we say sit straight. So a very simple thing which is ignored is when you sit straight, especially singers, do not raise your shoulders. The moment you can try it out. The moment you raise your shoulders and start breathing, your breathing is not deep. God has created us in such a way that there is a frame already. You don't have to hold your body up. Drop them down and straighten your back. So this part has to be very loose. So when we have vocal exercises in our workshop, we first do relaxing exercises for the shoulders. Do not raise your shoulders when you breathe in. Big cross. Breathe in, they say through the stomach. That's called abdominal breathing in world music. If you go online, you will see. So much so, opera singers, they are trained to feel the air here on their sides. That's the ideal way of breathing for all styles of music in the world. So just sit quiet like this. This is the way we have to sing. So please do not raise your shoulders. You don't need them to hold them up. They are straight by itself. It is the spine which you have to straight. So that your stomach is free to help you like bellows for the support. That's why they say Adivaithilendu Paadu in Tamil. That's a core you were talking about. In order to involve the core, you should habituate abdominal breathing. Now, improving lower octave.
The question was about lowering the...
No, without memorizing the Sahitya.
Okay, fine. Now, memorizing the Sahitya.
I
Yeah.
you see the book.
Yeah, so should not, better not. Okay, important point I'll say. So generally when we sing low, the habit is to do this, right? It is psychological. If you do like this, you should not do, because you are bending the pipe, the resonatory passage you are bending. It's very, very hazardous. And doing this while going up you are stretching. Don't do that. The only minute evil that you can do is, only one you can do is, when you go high you can tilt downwards a little. Otherwise all this movement is okay, you can sing, all that is okay. But this and this is bad. So one thing is you memorize the lyrics. 2. And please remember, lowering your chin is not at all helping you to reach the lower notes. It is in fact troubling you. Don't do that. And of course, our style, Carnatic style is a very intense style. With Sahityam, too much of it is an impediment. I'm sorry to say that. Because of which we have to use the jaw to articulate very often. Because of which, again, there is a jaw intrusion technique. Akaram has been compromised with. So a lot of voice issues happen because akaram, it's called a naked phonation anatomically because it comes from the vocal cords directly. Sada palaya. Sada palaya. If I were to sing Sada palaya, I have compromised on the akara already. Sada palaya. This we have to improve. All the musicians are now correcting themselves. What is happening? Akaram, when respected, gives the voice a longer life. So ultimately the voice should be younger than the physical age. So we are actually overusing it by the energy, voice energy is coming out. But even you're saying as it is pushed back to the source. So there is a stress. Arittam or intensity of a gamaka is in the notation, not on the vocal cords. Those who have understood this, Balamurali Krishna sir, look at the voices. What is not necessary, it's like something is moving, you want it to move easily and fast, but you keep a big weight on it. So there is another school of thought that it has to be sung like that, that is why the style is like this. But what is at stake? Your voice is at stake. So that means something is wrong, right? We have to think. Okay.
There is one question.
There
are many artists used to say that please practice only lower octave and there is no need to practice upper octave. It will be automatically enhanced or something, what you say. So especially in North Indian teachers and artists. So always practice lower octave and there is no need to practice upper octave. So what do you say on this part?
We have several Hindustani expert vocalists.
Yes.
Yeah. With God's grace, I'm having the good fortune of meeting a lot of Hindustani singers also, both playback, Bollywood playback, and Bhimchan Joshi sir's students, Suresh Watkar's students. So they say morning hours you should practice the lower octaves. but does not mean that you don't practice the higher octaves at all. I hope my Hindustani vocalist counterparts here, do you feel so? Do you agree with me? Yeah, you need to practice. So it is like this. If you practice lower notes, not only your lower octave is improving, higher octave is also improving. But it's not enough if you improve. You need to sing and apply it there. So you have to practice. It gives you a freedom of voice up there. It's like a very strong foundation of a building. You can beautify the 8th floor, but you have to build the 8th floor. You can't say this is strong enough for 8th floor. You have to build it. The same way.
Like Parveena Sultana, madam. His voice is excellent and also up to Tarastai.
Balance singing. How do you balance singing in 2 or 3 pitches when you have to teach, let us say 2 hours in a day you have to teach? And
so what you can do is you will have to arrive either on your own or with help of a voice expert. Certain exercises which your voice needs in order to maintain that space. Like a yoga every morning. Every morning each of us can arrive at a passage. That has to happen every day. Only then you can maintain a long life for your voice, and current date, the demand on the voice is too much. See, I think 40, 50 years ago, there used to be one concert for a musician a month. Even now, other parts of the world, they ask, when is next month, where are you singing? Here every day. In Tamil Nadu, during the season, morning one, evening one. And next day, voice is gone. Then I run about with a magic wand. It's very difficult. So, as I told you, it's very, very unique to each body. You have to understand your vocal strength, your vocal weakness, your space, and what are the shrutis you are using, how one can help the other. It also depends on the raga that you are singing a lot. So I think today there is a paper on that, Certain, I was very happy, Oral hygiene also, which is pivotal for what? Oral hygiene, please remember this. One is, of course, we all know, we brush our teeth, all that. If you have spices, please see that you wash your mouth and drink water. Even here it is not staying. So that comes under hygiene only. That is why I have to touch upon. Please, if you are a person who sings 2 to 3 hours a day, please do a steam inhalation every night with your mouth open. That takes care of the problem of the day. So would you all mind repeating after me, just to show you, there are so many things that you open your mouth and can I have D? D. Sorry if my voice is not cooperative because I've been talking. D. त्वमेव माता च पिता त्वमेव त्वमेव बन्धुश्च from here again. Sakha tvameva. Tvameva vidya. Dravinam tvameva. Tvameva sarvam mama. Deva more water we drink. Start your day with 2 glasses of water. Empty stomach. Please drink plenty of water and sleep well. Be happy because stress, and just sing. We are specially acute, but in your life, the most respected aspect should be your voice. No unnecessary talk, no rude talking, only happy talking. Put a sticker here called fragile. Thank you.
SwayamPrabha. Digital India. Educated India.